Hello everyone, my name is Guilherme and I am a medicine student at UFLA. Me and Ana Laura, we have worked together in a project related to first aid procedures. The target of this project is to teach first aid procedures to common people that works in some companies here at Lavras. First of all, what is first aid procedures? First aid procedures is everything you do to help or save someone. We have procedures in different levels of difficulty and you can do some courses to improve your skills in this area. Why should I learn these procedures? You should learn this kind of thing because there is a large probability that you're gonna need to do this at least once in your life. How many times do you saw an accident at the street, or someone with a broken bone, or someone that is bleeding out? Those are some examples of situations that requires first aid procedures. Another important question is, should I do all the work alone or by myself? No, you must claim for help, that anyone who has skills to help in the situation. There is more chance of successful if someone help you. As example, the other person can call SAMU at number 192 while you are talking to the victim. The last question is, who is obligated to execute these procedures? In our penal code, there is an article, the article 135. This article says that you are obligated to help someone that is in a bad situation. If you don't know how to save or help this person, then you should at least find someone who can, or you should call to an emergency service. Here we have SAMU and Bombeiros. Call 192 for SAMU or 193 for Bombeiros. Now we're gonna see some videos about first aid procedures.
In this video, we will teach you what to do if you found someone collapsed. The initial assessment is called a primary survey. This is a quick, early assessment to establish how best to treat a casualty in order of priority. We can use the initials Dr. ABC or DRABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. So, when I see a casualty, first, I'm going to check for any danger to make sure it's safe for me to approach them. I don't want to become a casualty myself. Then I'm going to see if I can get a response from the casualty. As you approach, introduce yourself. Ask them questions to try to get a response. If they're not alert and do not respond to your voice, kneel down beside them and gently shake their shoulders. Hello, Amy. It's Winston. Can you hear me? Open your eyes. Still no response? You can pinch their earlobe to see if they respond to pain. Depending on how the casualty responds to you, will establish a level of response. We use the AVPU scale, and each letter can represent the casualty's level of response. A, alert. V, response to voice. P, response to pain. And U is the casualty unresponsive to stimuli. If there's still no response, they are unresponsive. We need to check the airway. Is the casualty alert and speaking to you? You know that there's no problem with the airway, it is clear. If the casualty is unresponsive, open the airway by putting one hand on the forehead and gently tilting the head back with two fingers under the chin. Now we need to check to see if they are breathing normally. We do this by placing our ear and cheek over their nose and mouth, looking down the body to see if the chest rises and falls. We do this for 10 seconds. If the casualty is not breathing normally, call for help. Ask them to call 999 or 112 for emergency help and bring an AED. If you are alone, call for emergency help using a mobile on speakerphone and begin CPR with chest compressions. The casualty is breathing normally, so I'm going to check their circulation. Are there any signs of severe bleeding? Look and check down the body. If you find severe bleeding, try to control the bleeding to prevent life-threatening shock. Call 999 or 112 for emergency help before continuing to treat the casualty. You may also need to treat them for shock. I've established that my casualty is not bleeding. So remember, to do a primary survey, follow the order of Dr. ABC. Complete each step in that order as quickly as possible, dealing with any life-threatening conditions as you find them. Call for emergency help. Call 999 or 112. And that's how we perform a primary survey. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
Hello, my name is Ana Laura, and I'm also a medicine student. As Guilherme already said, as citizens we must all be prepared to help someone who is in a dangerous situation. So, in order for us to do this, the first thing we got to do is to stay calm and be confident in our ability to save someone's life using some simple few procedures. For that, we must keep in mind the initials GR, ABC, D of danger, R of responsive, A of airway, B of breathing, and C of circulation that were said in the video before, as they will guide us in what to do sequentially. We would like to emphasize, though, that before you rush to go help someone, you need to take a moment to analyze the area and spot anything that could injure you. Remember that if you get injured, you won't be able to help the other person. It is also important to remember that since we are in Brazil, our emergency number is 192, which is the SAMU number, and we must use it responsibly. And to finish this presentation, we would also like to show you another video that teaches us what to do with a person who is shocking, as it is a very common occurrence in our daily lives. I hope you all enjoy it.
If you think an adult or child is choking, ask them, "Are you choking?" Cough it out. If they are coughing, encourage them to continue, as they may be able to remove the obstruction. If they're unable to speak or cough, they need your help straight away. If coughing doesn't work, slap it out. Support the upper body with one hand and help them to bend forward. Use the heel of your hand to give up to 5 sharp back blows between their shoulder blades. Then check to see if there's anything in their mouth. If there is, tell them to pick it out. If back blows don't work, try giving up to 5 abdominal thrusts. Squeeze it out. To give the abdominal thrusts, stand behind them. Put your arms around them and link your hands between their tummy button and the bottom of their chest. Clench your lower hand in a fist, grasp your fist with your other hand and pull sharply inwards and upwards. Repeat up to 5 times. Check their mouth. If they're still choking, call 999 or 112 for emergency help. Use a speakerphone if you can. Keep repeating the 5 back blows and 5 abdominal thrusts until the blockage clears or help arrives. If they become unresponsive, open the airway and check their breathing. If they are not breathing normally, start CPR. So remember, if someone's choking, cough it out, slap it out, squeeze it out. If it's not cleared, call 999 or 112 for emergency help. Keep repeating the cycle. Start CPR if they become unresponsive, and that's how we treat choking. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate. As you start weaning your baby, small items of food may get lodged in their throat and they may choke. They can also choke on small toys or household items. If a baby under 1 year old is choking, you'll notice that they'll be unable to cry, cough or breathe. What we're going to do now is administer some back blows. So first of all, you need to lay your baby face down along your thigh, making sure you support their head and their neck. Next, we're going to administer those directly between the shoulder blades using the heel of your hand. Give up to 5 sharp back blows, making sure after each one, whatever it is, hasn't come out. If the back blows don't work, we now need to move on to giving some chest thrusts. So we need to turn them over so they're lying face up, again making sure that their head and their neck are supported. Put 2 fingers in line with the armpit in the centre of the chest, and pushing down sharply, administer up to 5 chest thrusts. If this doesn't work, call 999 or 112 for emergency help. Repeat 5 back blows and 5 chest thrusts until help arrives. If they become unresponsive, you will need to start CPR. So remember, if your baby is choking, check the mouth, slap it out, squeeze it out. And that's how we treat a choking baby. Thanks for watching. Help support St John Ambulance. Donate today.